G'day, my name's Dr Andrew Pennington and I'm the practice principal and an integrative GP at Sanctuary Lifestyle Clinic. Today I'd like to talk to you about the role of nutrition and its importance in mental illness. In Australia, the most recent data we have suggests that at some point in your lifetime, around 45% of people will have experienced a mental illness, which is pretty staggering really. At any one point in time, there could be up to 10% of us who are suffering from some form of mental illness. Many have wondered about the role of nutrition, the role of a good diet. Does it have a role in mental illness? And I think intuitively many of us know that we reach for comfort foods when we're feeling down, or we might feel a bit of a pick-me-up when we've had a good meal. But we haven't really had a lot of good evidence in the literature that this actually makes a difference to mental illness until recently. For a little while now, we've known that good quality diets, which generally involve including a lot of vegetables, fruits, whole grains, and oily fish, can actually be involved in preventing mental illness, particularly mood disorders such as depression and anxiety. And last year, a group in Melbourne actually published a randomised controlled trial, and what they did was they actually took a number of young people who were identified as having diets that were relatively poor, and they randomised these people into two groups. One that receives social support, as you would normally get if you are suffering from a mental illness, and I should have stated these groups of people also met the clinical criteria for a depressive illness. And they randomised them into social support and dietary improvement. And the dietary improvement was essentially to increase the amount of vegetables, fruits, whole grains, nuts and oily fish that they ate. And after I think it was around 8 weeks, the study, it was very clear that this group of people that were randomised to receive the dietary advice did better than the group that did not, giving us the first really decent, robust evidence that food can improve your mood in the sense of treating depression. We also know from other studies in the past that the amount of vegetables and fruit that we eat makes a really big difference to how we feel. And this data comes again from an Australian study where they collated a number of groups of people and looked at their health habits in terms of their diet and categorised them according to how many fruits and vegetables they had every day, and then looked at their mood scores. And they found that the group that ate one or less vegetable and fruit per day on average, compared to a group that ate 8 or more vegetables and fruit per day, had significantly improved happiness and wellness from a mental health perspective. This was really interesting. And they actually made a score of mental happiness. I can't remember exactly how they calculated it, but it was a few different factors. And the score essentially was the difference between eating 1 per day versus 8 per day was equivalent to the improvement in happiness that one might receive from going from being unemployed to employed, or actually about half of the improvement or half of the effect that it might have if you actually had a marriage breakup. So it's quite significant, this improvement score that you had from eating an improved diet. Then there's also some individual characteristics about nutrition that can affect one's mental health. And this comes around an understanding from some data from Dr. Carl Pfeiffer and Dr. Bill Walsh in the United States. And they have looked at individualizing different mental illnesses according to biochemistry. And what they've found is that not all people who have depression or schizophrenia have exactly the same types of biochemistry in their brain, and each of these people may benefit from a slightly different dietary strategy, and often they benefit from having certain nutritional vitamins and minerals and amino acids and good fats that can actually assist their brain to function better, and in many cases they can resolve or significantly improve their mental health symptoms. And this is very exciting, and I've seen this happen now many times in the 4 or 5 years that I've used these techniques with patients. And it's very exciting because I find that in many cases I don't need to use any drugs. I'm not opposed to using the medicines where they're appropriate, but I often find that I don't need to, and that these approaches offer a better side effect profile so that patients don't get as sick as they may be on some of the antidepressant or antipsychotic medicines, and they often feel better long term. It's a really exciting approach. So I just wanted to make you aware that one of the things we do here in Sanctuary Lifestyle Clinic is we treat people individually. We try to understand their biochemistry in their brain from an individual perspective, and this involves understanding what that chemistry does to traits in that person, and then also testing through pathology testing to find out what type of chemistry may be going on in that person's brain. And then, as I mentioned, using specific lifestyle strategies, specific supplement strategies, and in some cases some medication strategies. And combining all of that holistically, we get the best result I often find for that person's mental health. Perhaps this video may have been interesting to you and you realise that you may need some help in this area. Let me encourage you that if you're in a crisis situation, to call Lifeline 131114, or you can turn up to your local hospital emergency department. However, if the situation's not so urgent, we'd love to see you here at Sanctuary Lifestyle Clinic. Just click on the little details below of this video, and within that you'll see links to our website, sanctuaryclinic.com.au, where you can book an appointment if you desire, and you can also book through our Facebook page. Just search for Sanctuary Lifestyle Clinic, or you can call 1300 723 070.